So I've been doing these types of injections for the past 5 years, and I've been a nurse practitioner for almost 8 years.
Oh, wow. So would you say most of the stuff that you're doing currently right now is in the stem cell market, or is there a little bit of stem cell, a little bit of PRP, a little bit of?
Yeah, I think our practice, definitely the bread and butter is stem cells, but we offer a wide variety of services to try to fit every patient and to fit, fit every budget, every need. We treat peripheral neuropathy, we treat autoimmune diseases. We've been treating, we offer a lot of whole body wellness packages, to try to take care of the whole self. I mean, that's kind of where regenerative medicine, that's kind of the point, right? We're fostering the body's unique healing properties, and we're basically trying to re-energize these cells that have kind of been laying dormant in a person's body for many years.
Oh, wow. Okay. And
just a little bit of background on what I think there is some misconceptions, as you touched on earlier, exactly what a nurse practitioner is. And I think a lot of people think that, they just kind of work in hospitals, but that's really not true. Nurse practitioners can work in every specialty, from endocrinology to neuro to GI. And our role is only getting more expansive. We, can do pretty much everything a physician can do. Most don't perform surgery, but that's about it. We have a lot of us have prescription powers and things like that. So we're very, very deeply involved in medicine, I think more so than people even think.